Or good evening. Today is May the 14th. It's a Wednesday. So, update from last week. Last week, as I said, I got my PET scan results and had the news that according to the PET scan results, the tumor on my epiglottis or vallecula, whatever they call it, was localized. Anyway, so this week, yesterday, I had an appointment with the radiation oncologist and an appointment with the surgeon. The radiation oncologist was one of the nicest doctors I've ever met. He spent over an hour in the examination room with my wife and I, and explained in great detail about everything you'd want to know about the upcoming treatment. That visit went well, and then we went and met with the surgeon in Celebration, Florida, which is a little over an hour away from here. And again, very nice doctor, very knowledgeable staff. Both the radiation oncologist and the surgeon both did my wife calls it a snorkel, where they put a scope up your nose and goes down and looks at the tumor and in the throat, and it's not the most comfortable thing to have happen if you've never had it happen. And I did the first one without any lidocaine or whatever, being a tough guy. The second one I took it, and I'm glad I did, because it doesn't take all the pain away, but it makes it a little more bearable. But anyway, that was getting off track. So I met with the surgeon, super nice guy. He felt comfortable that he could remove the tumor within the margins, meaning that when they remove a tumor, they have to take a bigger section of tissue than the size of the tumor, obviously. So if you can imagine, if the tumor was the size of a dime, they're going to go around that about 2 millimeters larger than the size of a dime. And that's to ensure that they get everything and that they're not leaving a piece of the tumor in your body to grow. So if I went the surgical route, they could literally do it in 2 weeks. He said, in fact, he gave me a surgery date for the 28th. And if I did that, I would go in and have the surgery, stay overnight. They would remove the tumor, put a feeding tube in, and because I wouldn't really be able to swallow for almost a week, I guess because of the swelling and other things, the pain. And then I would come back a week later, and they would remove the feeding tube, and then I would begin working with a speech therapist to regain whatever swallowing ability that I might have lost. Again, in my case, the tumor is located on that flap in the throat that seals off your windpipe whenever you eat or drink something. And so if they surgically modify that in some ways, there can be you may have to relearn how to swallow, or you may have swallowing problems. And so that's one of the things that you have to weigh and consider when you're making your decision. Radiation apparently has some of the similar things. The radiation, repeated radiation to that part of your anatomy, that epiglottis or vallecula, can make it a little bit stiff, or it doesn't function as well as it would in the past. So both have some risks associated with future issues with swallowing and that kind of thing. So but anyways, back to the surgery. So they would do the surgery, have a feeding tube for a week, come back, and then remove the feeding tube, do some speech therapy, swallowing training, I guess. And then in about 2 weeks, I would go back, and then they would do a dissection of my lymph nodes, where they would cut open the sides of my throat, neck, and go in from the outside, and they would remove the lymph nodes on both sides. And the reason they do that, as I said, even though the PET scan did not indicate there was any cancer in there, you could have just a few cells of cancer or a very small, minute amount in there that doesn't show up on the PET scan. And so they want to be sure, and so they go ahead and remove those lymph nodes, because where this tumor is located, its natural drainage would be into those lymph nodes. And so in order for the surgeon to have confidence that they're removing the tumor and any potential sites to where that tumor could have potentially spread, no matter how minute, they remove those. And then you're kind of done, I guess, at that point. And then they would do some follow-up scans to make sure that everything was fine. It doesn't sound pleasant, honestly, to me, that you have the potential of losing some swallowing ability. I'm a person who loves to eat, love to have a cold beer. You take those two things away, and man, I don't know. But anyways, so it's something you have to weigh. Likewise, radiation, same thing. They're when they do radiation, there can be some impacts to your ability to swallow. They can be short term. Well, there will be impacts short term, but they can also be long term as well. So this is a big decision that I haven't made yet. I think the more I thought about it last night, I kind of found myself in a place of thinking that I'm going to go the radiation route. But I don't know. To me, the cons of radiation, after hearing both, well, I'll say the pros. The pros are it's very effective, very highly effective or highly effective cure rate for the type that I have, which is, they classify it as a stage 1 or 2, and so they feel like it's very curable, and the downsides are that it's 7 weeks, 5 days a week, so it's a long process. I've got to drive to that location every day, Monday through Friday, for 7 weeks, get the treatment, get the radiation. And my understanding is that as you progress throughout the treatment, then that your throat gets raw, and you start experiencing the symptoms. As the radiation starts to add up, and so that's kind of the downside. The upside with doing the surgery is that it's quick. You go for an appointment, you get this, you have the surgery, you go home the next day, you come back a week later for a follow-up. You do some swallowing training, hopefully that it's not too intense, that your swallowing's not been affected too greatly. And then a couple weeks later, you have the dissection of the lymph nodes, which I don't think would be, other than maybe some tightness in the neck, I don't think that would be such a big deal. So, and then you're done. But to me, the downside is there's always that potential that they're not able to get everything, or there's not a high level of confidence that they were able to get everything or get with the margins that they needed to get, and you end up having to do subsequent radiation. And so now, to me, that throws a whole new wrench into the deal, because if you have the surgery and you've affected the slightly affected the epiglottis or the vallecula, and then you have to go in and do radiation as well to it. Now that part of your anatomy has taken a double whammy, and it obviously could impact your swallowing ability long term. So we've got some big decisions to make. I've given myself the rest of today and tomorrow morning. I think I'll make my decision as to what route I'm going to go, and then call both the providers, the surgeon and the radiation oncologist, and let them know, what my decision is, whether I'm going to do radiation or surgery. And then the plan is, once I do that, I will I'll make an update once I do my first treatment, whether that be right after my surgery or after my maybe my first round of radiation. So it could be a little while. It could be a few weeks before the next update. Again, lessons learned here for people who might be going through this. I would say this. I would say maybe write down a lot of questions that you have prior to going in to meet with people that are going to be doing your plan of care, and make sure that you ask all those questions, because when you get in there, if you just try and think of them off the top of your head, you're not going to remember them. I was lucky I had my wife with me, who's very bright, and she asks a lot of questions I don't think of, and then she can remember the answers a lot better than I can as well. So but I would say write down your questions to make sure that you don't walk out of there going, man, I wish I would have asked this. The other thing I would say too is try and watch as much and read as much literature as you can on your particular type of cancer, so that you can see what has been successful for some people and what has been not successful for some people, and then have those specific conversations with the doctors, so that you can feel comfortable that as to where, on a scale of 1 to 10, say, are you vulnerable to any of those failures that they have, and likewise where you are on that scale to having success. So because that'll give you a lot more peace of mind when you're making decisions, or even just preparing yourself for treatment, if you only have one option. So that would be my advice, and like I said, I'll try and share little things that I'm learning, I guess, as I progress through this process. So appreciate your time. Hannah, what do you think? You appreciate it too? This is my dog Hannah. She's my buddy. She's gonna help me go through all this together, right? All right, have a good one, folks.